Duval DOGE is asking for answers from several key players it suspects could be part of a Medicaid and Medicare fraud scheme tied to the city's telehealth provider. Action News Jax state and local government reporter Jake Stofan has been following the story. And Jake, for now, city council members just hope those entities answer their questions.
And those entities include the mayor's administration, JFRD, a company called Emergency Resources Group, and Telescope Health. The committee's also trying to get some questions answered by UF Health to figure out whether the city's indigent care provider is truly benefiting from the telehealth service that's specifically supposed to target the uninsured. The Duval DOGE committee is investigating links between city health officials, Baptist Health, the hospital's emergency room staffing agency, and the city's telehealth provider. Based on new questions and records requests submitted by the committee, the concerns surround JFRD's medical director, who works in Baptist Health's emergency room, and the connection between Baptist, Emergency Resources Group, and Telescope Health.
First thing I was asking for is essentially communications between Telescope and the administration, so the other side of what I was asking for earlier. Same thing with Emergency Resources Group, same thing with JFRD.
Councilmember Roy Diamond, who's spearheading the inquiry, wants to know whether JFRD's medical director is able to steer ambulance traffic and verified Telescope Health's claim that it cannot bill Medicaid and Medicare. He also wants to see the math behind Telescope's claim it saved hospitals and the city $11 million, despite the fact the city's indigent care provider, UF Health, continues to see indigent care costs rise.
Everybody who comes and gets money from the city of Jacksonville has a great pitch, right? But there's millions of dollars going out the door. We could either put that back in the pockets of taxpayers, or we could use it for indigent care directly.
On Monday, Jacksonville's chief health officer, Dr. Sunil Joshi, told Action News Jax it's up to hospitals to leverage Telescope's telehealth services by referring patients to the service. And he notes UF Health's share of those helped by Telescope is up from about 10 to 20%.
And believe me, they understand that this program can be very helpful for them also.
He also pushed back on any suggestion of Medicaid or Medicare fraud.
So if you are seeing people without health insurance, you're not billing an insurance company, how could you possibly be committing Medicaid or Medicaid fraud, Medicaid or Medicare fraud? I mean, you cannot.
Now, there is no formal requirement for the questions submitted by the committee today to actually be complied with, at least not at this point. If the committee doesn't get the answers it's looking for, a special investigatory committee with subpoena power could be convened. For local coverage, you can count on Live on the South Side. I'm Jake Stofan, Action News Jax.